The Muslim Community Center serves thousands of families in Maryland, Virginia, and Washington, D.C. area. The idea of the community center was first conceived in September 1976, and it was dedicated and occupied for use in May 1981, and has since grown to become a national recognized Islamic center. Muslim Community Center, or MCC, has become prominent by offering services and programs for the benefit of our community at large, such as education and health clinic. This organization is dedicated to serving all human beings.
Our educational activities consist of the Sunday school, Quranic classes, and classes for Arabic, classes for English, and any other need which our children and our adults might have. We started the clinic in 2003 because there was a great need which went unserved for the community members and our neighbors who could not afford insurance. They were out of the services provided by the state and by the insurance companies. Initially, it was a very simple operation. The need for the services continues to increase, but of course we have a limitation, mainly of the funding and space. People who cannot afford to pay the lab fees and the fees for treatments outside the clinic are provided as much as possible from the zakat and sadaqah donations by the Muslim Community Center. So therefore, nobody is actually asked to forego because they are unable to pay.
People who cannot afford, who cannot pay anything at all, we also help them with the charity. We have two different kinds of charity, zakat and the sadaqah. The Muslim people, we help them from the zakat, the money they need for the medication or the blood test or whatever need to be done. Second, if it's a non-Muslim, we give the money from the sadaqah, so we can take care of the non-Muslim and Muslim. And by the way, the clinic is open to all. We serve the whole community, Muslim and non-Muslim, and we are part of this community. Jazakallah khair. Assalamu alaikum.
The MCC Clinic began operating with a monetary donation from a volunteer physician and an in-kind donation of office space donated by the Muslim Community Center of Silver Spring, Maryland. Many other people donate their time and money with a mission to provide free, high-quality medical care to uninsured, low-income adult residents of Maryland, such as Dr. Qadri, Dr. Yusuf, Dr. Nasreen Congo, Dr. Tahura Kawaja, Dr. Muhammad Khalid, late Dr. Alam, Dr. Siddiqui, and several youngsters providing office help. Dr. Muhammad Yusuf donated all his furniture when he decided to retire from his private practice. He also donated a large amount for the expansion of this clinic. Although he has officially retired several years ago, he is still seeing patients at MCC Clinic. Dr. Nasreen Congo and Dr. Siddiqui are two doctors that joined MCC Medical Clinic from the start. Though their busy schedule does not allow them to devote much time at the clinic, they are still part of our volunteer corps.
The idea was to provide some basic medical care to uninsured low-income people. At that time, we continued to provide the services. More doctors, mostly volunteers, joined the program. And initially we only had volunteer paramedical staff, but as we got busy, subsequently hired nurses and other necessary staff, including receptionists, full-time telephone operator, checkout people, accountant, etc., etc. And at the present time, this is a full service clinic, provides services in primary care medicine, but also we have managed to make it a multi-specialty clinic. We provide services at the site for many other specialties of the medicine, including cardiology, gastroenterology, nephrology, physical therapy, etc. We have a full service women health clinic here. We have a gynecologist who works twice a week, pap smears, breast exams, orders mammograms, and does other kind of biopsies, endometrial biopsies, colposcopy, if needed, to evaluate for either cervical cancer, infections, etc. We have a large population of diabetics who need an eye care, and we have a full eye care center here for those people. After all that said, I have to say that this has been a very successful project, probably one of the best services MCC organization is offering right now. The clinic is well known nationally as well as locally, just simply because of the fact that we provide the best possible care that our patients can get anywhere. The primary funding is from Montgomery County. We get certain amount of money per patient, per visit, etc., which is the basic funding. But in addition, we have managed to acquire some grants, particularly the diabetic grant, women's health issues grants, and domestic violence related grants. And in addition, Kaiser Permanente has given us a grant last year, and this has been renewed this year again. And our volunteer coordinator is responsible for that, and who has worked hard and continues to work hard to get these grants renewed. We have also developed a good network with other doctors for the services which we cannot provide in the clinic, like we have networked with the National Institutes of Health, which is called NIH, Department of Cardiology. For remaining surgical interventions, we're grateful to be associated with Archdiocese of Washington, D.C., also called the Catholic Charities, through this charitable organization, all patients who need surgery are referred to this organization, and they get the surgery free of cost.